I'm Dr. Jeremy Smalley with Lewis Gale Physicians Orthopedics, and I'd like to talk with you about shoulder arthritis, shoulder replacement options, and a new navigated technology that I'm pleased to offer now in the Valley to allow personalized fit with standard implants to optimize patient results. So shoulder arthritis is a wear and tear phenomenon similar to hip and knee arthritis. We have joint replacement options that have been developed over a period of time. But there's a couple particular aspects to shoulder replacement. Number one, we have the traditional shoulder replacement option, which mimics the native anatomy. Your ball and socket joint wears out, we replace it. Your muscles still work, it holds nicely together, and the implant provides good pain relief and very good prognosis for function. However, there's another problem that happens with shoulders called cuff tear arthropathy, where the rotator cuff, which is muscles that lives on the outside of the shoulder blade here, and stabilize the shoulder holding the ball to the socket, can be torn traumatically or wear out. That leads to a different pattern of arthritis that also needs to be treated with a replacement, but it needs a bit different geometry that we call a reverse shoulder replacement, where the cup and the ball are reversed, and the shape of the implants here holds the arm in position and keeps it aligned with the big deltoid muscle on the outside holding the implant together and holding the joint aligned and making the shoulder move. So we have two good implants for some pretty bad problems. What's the next step? Well, the next step is to try to optimize things, to take away as little bone as possible, and to provide patients the optimal outcome. And the weak point is always the glenoid. So the glenoid is the socket part of the shoulder. Unlike a hip socket, which is a nice cup and a ball goes up into it, glenoid is essentially more like a tee on which the golf ball of the shoulder fits. And so as you can see, there's very little bone here, and when we do surgery on this is the deepest part of the shoulder. It's deep down in the shoulder underneath of the spine on the back of the shoulder blade that's very difficult to see and get a good orientation view to put the implants into optimally. What we can now offer with the navigated GPS system is to scan the patient's shoulder in advance in a high resolution 3D scan, import it into the computer, and then template it. And what that means is I can look at it on the screen, I can look at the patient's particular anatomy, and whether it's simple or complex with a lot of bone loss, we can pick from a broad list of available implant shapes and sizes to position it in such a way that it keeps as much bone as possible while giving the patient the best biomechanical results. Let's talk about the advantages for GPS navigation in surgery. Fundamentally, it uses a motion capture technology similar to what's used in movies. There's a sensor on the end of a sleeve over the drill that I use to drill the holes in the bone to attach the implants. Using the GPS navigation system, running it live, I can put the center tip of that at the optimal point, spin it, and take off just enough bone to make it smooth and no more bone than necessary. That takes a couple extra minutes, but it's absolutely worth it because it saves time on the really important part.